and welcome back to our show. Today, we are going to be talking about skin cancer and how to treat skin cancer with lasers.
Yeah, I'm excited. Let's dive into it. All right. So, what data do we have as far as what types of skin cancers can we treat with lasers?
So, the best data we have is going to be including treating precancers to stop them from becoming skin cancers, and then also for two types of skin cancer called basal cell and squamous cell.
And there are particular types of basal cell and squamous cell that are most studied, and as far as efficacy of lasers, that would be superficial basal cell and squamous cell in situ. Both of those terms meaning the top layers of the skin, nothing that's deep or involving deeper layers of the skin. So if those are on your pathology results, then we have data to support that lasers can treat those two types of skin cancers.
So, meaning that they have not invaded deep into the skin yet. So, you're talking about superficial basal cell and squamous cell carcinoma in situ, which are just two different types of skin cancer, meaning that they have not gone deep. They're not going to metastasize. They're basically in the very, very top layers of the skin.
Yeah, and that's just what we have the most data on, that we can say what the efficacy of various lasers are. It's not that we can't treat other types of basal cell, squamous cell if they are deeper. It's just that we don't have data to truly tell patients, oh, this is your risk of it coming back, or this is the risk of us treating it, or all those things. So that's kind of how that works.
And there's a lot of ongoing trials on treating all types of skin cancer with lasers. What Dr. Kesty is talking about now is just we don't have very robust, randomized control, long-term clinical trials other than for basal cell and squamous cell, the superficial types of those.
Yeah, so it doesn't mean that if a patient comes to us, if it would be great if we had those on the pathology reports, but if we don't, if we have different types of squamous cell or basal cell, we can and we're comfortable treating those. We just have to go over the risks that, we don't have the robust data to say, oh, we are definitely going to clear this. Whereas if it were a superficial type, we have more kind of back science behind that.
Mhm. Yeah, which is important for cancer.
Yeah.
So tell us about that science. What is the efficacy? What do you tell patients?
Well, it's a variety of efficacy results depending on kind of what lasers are studied, which we'll go into as far as what lasers we use, but anywhere from just a vascular laser to ablative lasers or fractionally ablative lasers have been studied, and they vary between 30 to 80% as far as efficacy. That's 80% is probably, what we're aiming for, or 85%, because then you're on par with something like a topical chemotherapy cream or something like that. So that is probably where we're aiming for, but it is a wide variance as far as kind of what lasers are studied. So it can be as little as 30%. Usually it's kind of more, it's that 80-85%.
So when you're talking about using lasers for skin cancer, if there are studies on vascular lasers alone and then non-ablative and ablative lasers alone, what do you usually use for patients?
Yeah, so it depends on kind of what we're seeing. If it's a basal cell, they tend to have more vascularity. So going after the vessels that feed the cancer is probably important. So we do use a vascular laser, and then I would pair that with, depending on the size of it, probably a spot ablation, so 2 or 4 millimeters. And I'm basically going to where I feel the clinical edges of that skin cancer are. And hopefully, if it's a superficial one, I'm not going to leave a scar. If I do, then it's a very, very small, manageable scar. But if it is a superficial type, then most commonly we don't leave a scar if that's the case.
So a big advantage over, traditional surgery would be the scarring for the patient if it's somewhere, face, neck, chest, hands that they don't necessarily want to go through with a Mohs surgery or an excision or, an ED&C, cryotherapy, all these things that are going to leave scars. You can do lasers and have kind of either no scar or the smallest scar possible.
Yeah, exactly.
So that's a great option for patients.
Yeah. I mean, I think it's one of those things that, again, it's emerging. It's one of those things that we are going to start to see more commonly. It's not covered by insurance at this point. It may be in the future, but it is one of the things that people are reaching out to because they're aware that lasers work in a certain way where we can target blood vessels. We can go to a certain level of the skin. So if we have the pathology to tell us where that level of the skin is affected, then we can remove that safely and securely too. So that's really nice.
Mm-hmm.
So what do you think? Do you think we can prevent skin cancer with
Yes, for
laser?
sure. For sure, for sure. If someone in your family has skin cancer or you're a light hair, light eyes, living in Florida, or any of those above risk factors, definitely consider investing in a series of lasers with the laser surgeon to prevent getting skin cancer kind of anywhere that we laser, for sure.
And what's the data on that?
Oh my gosh, that's really good. The data on that is really good. I would say, when I tell patients I'm just a more conservative person, I say it decreases your chance of getting skin cancer by a minimum of 50%. But, that's the best data we have, which is not these kind of really long studies. I want to see like 50-year studies. Obviously, that's not possible because, lasers are a very new thing, especially the ablative lasers. I mean, it's 21 years old. Erbium's only 21 years old. So I would love to have 50-year data. We just don't have that. So what I tell patients is you're decreasing your chance by at least 50% and treating precancers.
Yeah, I agree.
So you can treat skin cancer. You can prevent skin cancer. Can you treat precancers and sun damage with lasers too?
Yeah, check out our whole video on that. But yes, for sure, we can use fractionating technology. We can reverse the signs of sun damage and then actually clear damaged collagen that then has a tendency towards skin cancer or precancerous lesions. So it's really important to use technology as we have it today to do the best by your skin for sure.
Mhm. Yeah, it's really amazing that we can kind of do all these things with laser technology with, minimal downtime for patient, 2, 3 days.
Yeah.
Do that a couple times, decrease your chance of getting skin cancer by at least 50%. Pretty cool technology.
Yeah.
Okay, so I have a question for you. So let's say that I'm a 45-year-old Caucasian female. Both my parents have had multiple Mohs surgeries on their face. They're all scarred out from the Mohs surgery. I, live in Florida. I have some sun damage, but I don't have any known precancers or skin cancer. What would your laser regimen be for me?
Well, it depends. I'd probably at least recommend some resurfacing, whether it be a CO2, erbium, or Fraxel, like a 1550. So something where I'm actually clearing damaged collagen and decreasing your risk of skin cancer in the future. Probably my other recommendations, not quite a laser regimen, but would be, a morning mineral sunscreen, a evening retinoid. And then I tell patients, even in their kind of 40s and 50s, that every 3 to 6 months you should be doing a regimen of like topical chemotherapy cream just to keep on top of anything that could become a precancer. A lot of the laser technology is going to take care of most of that, but if you're only doing a laser once a year, then at least every other 6 months you should be doing some type of topical chemotherapy cream, just so that as we get and acquire more sun damage, we're still continuing to clear that.
No skin cancer. Well, thank you guys so much for listening. If you have any questions about using lasers to treat skin cancer, please let us know.